plantar fasciitis is that not all heel pain is actually plantar fasciitis. This is a test you can do to try to distinguish between this and another common diagnosis called calcaneal fat pad syndrome. True plantar fasciitis is typically characterized by pain near the heel and in the arch of the foot. These symptoms classically present with the first few steps taken after a period of inactivity or first thing in the morning when you wake up. You can usually reproduce your symptoms when you push directly on the plantar fascia itself or when you push near the inside of the heel bone around where the plantar fascia inserts. If you do have pain near the heel bone where the plantar fascia inserts, a great test to rule out plantar fasciitis is if you're able to relieve pain near the heel bone when you actually pull the big toe up and back towards the shin. If symptoms get better when you do this, this could be a sign that plantar fasciitis isn't actually what's going on. Usually, treatment for this requires some type of cushioning for the heel or an orthotic to help offload the area where the plantar fascia inserts at the inside of the heel. If you only have pain when you push directly in the center of the heel, then likely what you're dealing with is calcaneal fat pad syndrome. For this, you want to do the same types of things to relieve stress at the heel. If you do have calcaneal fat pad syndrome or you have irritation at that insertion of the plantar fascia, this is a taping technique that can be helpful for reducing pain in the heel. For this, you want to use a pretty firm tape that doesn't stretch that much. I like using McConnell tape or Leuco tape. First, start by applying one piece of tape around the back edge of the heel. This will serve as your anchor. Take another strip of tape and pull the inside part of the fat pad towards the outside of the heel. Then repeat with 1 to 2 more strips until the entire heel is covered. The goal with this is to pull the fat pad together to provide better cushioning to the underlying heel bone. Most people who see benefits from taping usually will see it right away when they stand on the ground. There's a lot less pain in the heel. If this is you, then heel cups might be a great option for you. Another good option might be an orthotic. So whether it be calcaneal fat pad syndrome or true plantar fasciitis, we do know that in the short-term orthotics, either custom orthotics or off-the-shelf orthotics, those can be helpful in those first 2 to 3 months when you're having plantar fasciitis type symptoms. The most common mistake that people make with plantar fasciitis, though, is that once they get in the orthotics, they wear them for years. Short-term only, yes, orthotics can be helpful. If it's just calcaneal fat pad syndrome, the heel cup alone can be extremely beneficial. Another good option for someone with calcaneal fat pad syndrome is to wear a shoe that has a lot of cushion in the heel. These types of shoes can also be helpful for people in the early stages of plantar fasciitis. If you found this video helpful, please make sure to subscribe to my channel so that you can see more videos like it. And if you know of someone that's struggling with heel pain, please pass this video along. Thanks for watching.